The second common rugby injury that I'm going to talk to you about today is the injury of the acromioclavicular joint, which is the knobbly bit at the top of your shoulder there. This is where your collarbone meets your shoulder blade, or your clavicle meets your scapula. These injuries usually happen in one of three ways. So it's either if the rugby player that's carrying the ball gets tackled, his arm goes down with the ball underneath his arm and it gets forced into this rotated position here, which then sprains the ligament. It can happen when someone is tackling the player and they land directly onto the tip of the shoulder. Or the other common method as well is when someone is handing off or they fall onto the hand in this football position, so fall in outstretched hand, and as they fall it then forces the shoulder backwards, which can then sprain the ligaments as well. There are three stages to this injury. So stage 1 and stage 2 is where manual therapists and exercise therapists can be really effective in getting you back to normal in terms of encouraging normal motion, getting the normal strength back, reducing the chance of re-injury. Stage 1 is pain reduction and inflammation reduction. Stage 2 is making sure that we regain normal movement. So that's going to be full range of motion in all positions of the shoulder in this instance, so make sure we can rotate, go across, go upwards into a full position without being too painful. Then what we're going to introduce is some strengthening exercises to try and make sure that actually the strength regains to a normal point. Stage 4 and stage 5 are even more important if you are an athlete, if you are working within sport yourself. Stage 4 is about making sure that actually from there what we do is look into the vulnerable positions of the joint. With the shoulder, with the acromioclavicular joint, it's more like tapping that position, more like tapping that position. So making sure that we strengthen the muscle, strengthen the joint around those areas. And then stage 5 is introducing some sport-specific training. Ligament injuries, as mentioned in previous videos, they do take a while. You may notice significant reductions in your pain from a few days to a week. However, for it to be fully healed, it takes a minimum of 6 weeks, and it can be 6 weeks, 12 weeks, 18 weeks, even longer on certain instances. It depends on the severity in which you have injured yourself. So try to listen to your osteopath, your sports therapist, your physio. Make sure that you do pay attention so that actually you only injure it once and then you don't have to worry about re-injury, which can then set you back for even longer.